A mystery disease known as the gay plague has become an epidemic unprecedented in the history of American medicine.
Federal health officials say as many as 1 million Americans may have been infected with the AIDS virus, and more than 12,000 are expected to develop the deadly disease next year. Now, that would double the number of cases since 1981 nationwide.
On the witness stand, Dr. Ari Rubenstein, a renowned figure in AIDS treatment, who said he knew of no child with AIDS who had ever shown improvement after being diagnosed. A group from a parent federation representing 25 Queens schools has started to circulate this sign.
And in New Jersey, officials say that they will allow school superintendents to suspend students, teachers, or other staff who are suffering from AIDS.
Today from the Center for Disease Control in Atlanta, topping the list of likely victims are male homosexuals who have many partners and drug users who inject themselves with needles. Medical experts say the disease kills 4 out of every 10 people it strikes and that it threatens to explode in the nation's cities.
If you had HIV, you were expected to die. Hundreds of thousands of people were dying and millions more were being affected. But what happens if finally you have a generation for once that isn't dying, that for once is able to live beyond just the initial years after diagnosis? With breakthroughs in HIV medication, we're finally seeing a generation where that isn't the case. With better antiretroviral therapy, we're seeing the first generation from the AIDS epidemic reaching the ages of 65 and beyond. But they are the only generation with this many people because the development in HIV preventative medication such as PrEP has meant that diagnosis rates have been declining. It's a unique generation and they're fighting to work against at-risk narratives and how to deal with HIV and aging. Webinars, where people can join from wherever and hear panelist stories, are important ways to create counter-narratives. Ribbon, an HIV advocacy nonprofit, does educational seminars, and recently they did a webinar on HIV and aging. I wanted to share stories of the panelists because listening to their stories, to their perspectives, empowers me as a listener to hear directly from the inside, but it also empowers those speaking to define their own narrative. Not that of one defined by society's stigma and medical perspectives, but one from the inside.
I'm Rebecca Dennison. I've been living with HIV for 42 years. I'm 62 years old, although I've read that HIV ages us by 13 years, so maybe my body is 75. I was diagnosed in 1990, got pregnant in 1995 when that was controversial. Gave birth to twins who are now 28 years old, married to my husband who, after 40 years, is still HIV negative.
First of all, I'm a trans woman of experience of color. I run my own nonprofit, which is T2Q, Trans Quantum Questioning. Our motto is, if you can feel it, attain it, and see it, then you can do all the quantum physics that you need to survive in this world today, being non-binary and being a trans person of experience.
My name is David Fawcett. I am living with HIV since 1988. I'm a gay man. I'm also a psychotherapist. So I really wear 2 hats in this conversation. I think personally, one is as a professional who really deals with a lot of clients facing this. The other is as an aging gay man. I'm going to be 70 this year. I'm starting to have some of those accelerated aging things that I never expected ever to see this. And I'm feeling very personally some of the stigma that may be subtle, sometimes not so subtle, but it comes at us. And from healthcare providers, from friends, from even families.
Oftentimes, when you imagine aging, you imagine a happy old couple staying in place, not having to retire. But how does the aging narrative become influenced when you're living with HIV?
We're getting older. And here it is, you out there, if you don't have the food you need, or if you don't have the medications you need for high blood pressure, some people have like just homelessness with all that. So being 50 and above, because I don't want to disclose my age is 52, but anyway, being 50 and above, it comes with, by now in society, you're supposed to be stable. You're supposed to have that house. You're supposed to have that car. You're supposed to have that good job. Some people should be retiring. But because of the economy nowadays and how it affects minority and marginalized people, HIV is just one thing. It's just, we doing better, we living better with HIV, but we also got to understand we still people. We still have to live, we still have to eat, we still have to provide for our children if you have any. It's so much that just needs to be done, and only way we can do it is by us having these conversations and getting it out there. That's why I say I'm an open book.
But in addition to the aging narrative that changes when you live with HIV, there's also the physical environment that's impacted. In fact, in the general population in the US, an estimated 39% of older adults live alone, while 70% of older adults living with HIV live alone. And it's important because loneliness and social isolation are associated with a range of negative physiological and physical outcomes.
From an emotional point of view, I think that the isolation and the need to focus on it, because that kills. And it kills, and it doesn't have to be single people, it can be isolation in a crowded space. But it's the internal mindset of, are we feeling connected or not? Connected, supported, encouraged. Do people around me understand me? Do they get me? Or am I just kind of it's a harsh word, like some freak, for some doctor to look at who just makes all kinds of assumptions about who I am because I'm living with HIV for so long. I think just having a better understanding of us and people that really connect.
And beyond that too, those living with HIV who are aging have to argue for themselves to know what's dangerous about the condition, as Rebecca further mentions.
There's so many parts of it, but one of them is that we just weren't expected to still be here. We weren't expected to live this long. And so I don't feel like everything was so much a crisis that a plan wasn't really made for what would happen if we actually did survive. So as an example, when I started to get menopause, I went to see a gynecologist for the first time, and I went in with 4 questions as a woman going into menopause. Before I even sat down, she said, "I see you have HIV. How'd that happen?" And immediately I'm putting this defensive place of, are you trying to do that thing where my community gets sorted into the innocent victims and the people who got what they deserve? Because I'm not okay with that. I never got to ask my 4 questions because I was so stunned. And when you're in a doctor's appointment and you're so vulnerable that it's really hard to advocate for yourself.
But I also had more questions because there are all these at-risk narratives that are coming into play, and we see that there are those fighting against it, and it's those who are living with it. But what are the allies around us doing? I turn to ask policy experts.
I'm Jeffrey Erdman. I'm the Associate Executive Director for Programs for the Illinois Public Health Association.
How did you become involved in AIDS activism as a Northwestern student, and how did it go beyond Northwestern?
Back in the 80s and 90s, when we didn't have all the effective medication that we have these days, HIV was certainly more on everyone's mind, and it was much more of a threat, I would say, than more of a chronic health issue like we have now. So I got very involved because I am a member of the LGBT community, so it was affecting my community pretty intently back in the 80s. So I got involved. I wanted to make a difference. And so I started working with the Public Health Institute and committee at the Evanston Health Department. And then from there, I got involved in state committees on HIV and AIDS and sort of just moved into a career where I could focus on this chronic health issue and other pressing health issues in public health.
And do you think that the federal government has been focusing on this as an issue that's been developing? And do you think there's enough support for it?
I think we need to do a better job at the federal level with HIV and aging. In fact, there's a special program called the Ryan White program that's specifically designed for people who are living with HIV. It provides them medication, case management, healthcare, and other support services. That Ryan White program is just now starting to realize, hey, more than 50% of our clients who are in the Ryan White federal program are actually over the age of 50. So we need to create some services within the Ryan White program that are focused on people who are aging with HIV. So the federal level needs to work at the same way that the state and local level improving these services for people aging with HIV.
Finally, I just have one last question. And for us as students, it kind of feels like we're so small and inconsequential. But to work against that stigma, is there anything that you would recommend us students to be able to do to help push against the stigma for those living with HIV and aging?
Yeah, I would say get involved in your local community. I mean, there are many committees and there are many task groups, many volunteer opportunities, probably at Northwestern, probably in Evanston, probably in your local area to work on HIV prevention, to get the word out about HIV. There are many local spaces in the aging area that you can get involved in. Every area of the state has something called an area agency on aging, and that works on aging issues. And they are also working on HIV related issues. So, work with your area agency on aging to promote HIV prevention among people who are aging. Get the word out. If you can, advocate for policymakers and lawmakers about the things that we need to improve in the long-term care system, especially for people who are living with HIV. So policymaking and advocacy is always important.
We as students need to be important allies, and those living with HIV who are aging need us more now than ever, especially at a time like this, to work against the stigma of living with HIV. For the full ribbon webinar, check out the QR code below. And for more HIV resources in Illinois, check out the Illinois HIV Care Connect website.